take the red pill, you stay in Wonderland. And I show you how deep the rabbit hole goes.
Welcome to Life in Red.
So one of the most misunderstood things, I think, when it comes to our body and our health and our mental health is the connection between how we feel physically and mentally. And we don't really talk about it a whole lot. We just kind of pop our pharmaceuticals and try to feel better. So hoping to break down some of that conversation today by welcoming my new friend here, Danny Shapiro. Welcome. Thank you so much for joining me.
It's a pleasure to be here. Thank you for having me, Ryan.
Physical therapist.
A bunch of stuff today.
Yeah, physical therapist. You're in New York?
Yeah, Brooklyn, New York. Yep.
Oh wow. How's COVID been there? Because New York got they got hit pretty much one of the hardest in North America.
Yeah, we got pummeled pretty hard. It was in the beginning, like end of March, beginning of April. That's when shit hit the fan.
Yeah.
To put it lightly. It was bad. It was real bad. I'm considered an essential worker.
Right.
But even just to make sure nobody has to take any public transportation, no Ubers, nothing. I actually closed down my office for my physical office for about a month and a half, and transferred everything to like virtual care. But yeah, it was bad. It was real bad. Thankfully, It's a lot better. Like, I myself have visited the city a few times already, and it's so much better. But it was bad.
It's good to hear, and I'm glad that you're back to work and the office is open, because one of the biggest things to come out of this is, a lot of us are working from home now. And, I think a lot of our companies have spent quite a bit of money, whether that's in America or here in Canada, on, ergonomics and making sure the office and the workplace is the best giving you the best kind of way to work without getting too much pain. But now we're all working from home. And I know myself, I have this crappy ass chair where I sit on the couch where my back is all conjointed. And I was just at my physical therapist on Tuesday getting some work done. And we were talking about that and how many people now are coming in with pain. We're going to get to all that. But the first thing I kind of wanted to start with, and I was listening to your interview with my good friend, Tall Paul, who another episode previously on here. You were talking about the connection between mental health and physical health. And I think that is something that's really overlooked, like I mentioned off the top. In your experience, how much does someone's pain or discomfort or chronic issues, your patients, how do they come in mentally? How much does that really affect them?
So of course, everyone is very different, right? Everyone displays emotion differently. Everyone goes through injuries and life events very differently. However, even in the best situations or the worst situations, right, the mental health of the person coming in to seek physical help is extremely crucial. You cannot purely address the physical and ignore the mental and expect a positive outcome, right? When someone gets injured to the point where you no longer can do a certain activity without suffering pain or without jerking from a movement, because it's like as soon as you get somewhere, it's like, oh God, that hurts, right? So it messes with you on a daily basis. Pain doesn't just appear and disappear within a second, right? So it literally impacts your life. And when pain impacts your life to the point where you need to make adjustments and make changes to your daily routines, your social outings, even how you deal with your own family, and it really brings you down. And I'm not going to pretend like I know what everyone's going through, but I myself have been through a very serious injury 7 years ago. And I just keep remembering what that felt like. And that's how I kind of connect with all the people that I help, is that I just remember what that felt like and try to really get into the connection with the person that's seeking my help, because the mental health to treat the physical pain, you cannot treat one without the other. It's just not going to happen. If someone has a negative outlook on how their treatment is going, how they're feeling, how their day is going, the pain is going to have little to minimal improvements.
Right. I was always under the interpretation that a physical therapist was kind of there. I mean, like athletes had it, but it was more for people who sustain like kind of severe injuries, whether that's a sporting accident or a car accident or something like that, right? More of like a rehab, until I actually started going and going more for a maintenance thing. Would you say in your experience, because I think, I don't know a lot of people who visit a physical therapist. Do people who come to see you, is it like, I guess kind of like a last resort? Like, are people coming in, aside from athletes, that are just like, I'm in so much pain, I'm devastated, I have nowhere else to turn? Or like, am I kind of wrong in my interpretation of what a physical therapist is? There are actually a lot of people who come in and understand what physical therapy actually does.
Right. So from just to address like people who are, let's say, people who are good, right, or people who have had an injury but recovered, and I have a lot of people who have gone through that route where we started therapy, we got to that recovered point, like we feel good, they can get back to doing whatever it is that they need to do, but they still come in once every 2 weeks, once every 3 weeks for maintenance work, just to make sure that they got good, let's stay good.
Yeah.
Right. So I have a lot of people who do that. But physical therapy it shouldn't be treated as a last resort. It should be treated as a first resort, right? When you're experiencing pain, right, as long as it's nothing like internal, like something with the organs or something with the heart, right? Obviously, those things are very different, and you need to see an MD, a cardiologist, etc. But if you're dealing with pain because of some kind of injury, PT should be the first thing on your mind. We're the ones who get you back, not the doctors who prescribe you pain pills, Advil, paracetamol, and tell you just to rest and take it easy. No, that's actually the wrong approach to dealing with injuries. So we should really be the first resort when something happens, whether it's a back injury, a shoulder injury, or a thumb that's causing you pain and you can't lift weights or do push-ups, right? Physical therapy is an all-encompassing approach to the body. We are the anatomical masters, right? We make sure that you function properly on a daily basis. It's funny, however, though, that you mentioned the phrase "the last resort," because a lot of the people that I work with a ton of athletes, of course, but I also work with people who are not athletes. And I am actually their last resort because they've been to doctors, they've been to other PT offices. I've had people who've cycled through 3, 4, 7 physical therapy offices before they're like, all right, Danny, no one else was able to help me. You're literally like, this is it. I came to you because I saw what you did. I saw if it was a referral. You are literally my last stop. If this does not work, I'm looking at pain pills for the rest of my life, surgical procedures, and just misery. Meanwhile, these people have like 40 plus years, 50 years, 60 years left of life. And this is how they're looking at it, right? I had a 26-year-old, 27-year-old rather, come in, and he's had a lot of pain, full body pain, and he's been to, again, like 4 different physical therapists.
That's me.
And he was told he can't lift his arms over his head and he can't do anything. And it's like, dude, you have another like 70, 80, 90 years to go. And I don't understand that, right?
Yeah.
And it just, problems weren't addressed. So things like that, like I have people who come to me as their last resort because the other resorts were supposed to be a first resort did not work out.
Right. And I think to the opioid crisis right now, and I think, a physical therapist and all this really could have mitigated some of this disaster when, in Canada, but especially in America, that doctors were overprescribing, fentanyl and oxys and opioids to help treat pain, whether it was just a pain in the back, like your shoulder was sore, right? You were getting this. And I think that's most people, at least in my experience, like the first thing that happens when they experience some sort of pain or something wrong in their body, it's go to the doctor. It's not go get a massage. It's not go see if you believe in chiropractor or a physical therapist, right? Like none of those options I'll go see the doctor, and then if I need something else, they're gonna point me to it. They're gonna point me to the physical therapist if I need it. Is that kind of like with your clients, at least, like that kind of like the road that people always try to go on?
Typically, yeah. And look, at the end of the day, I would always rather someone go to their doctor first, just in case because back pain can also not be back pain and can actually also still be internal. You can have problems with certain organs or certain body parts that presents as back pain, but is actually something else entirely. So I'd always prefer someone go to the doctor just to be on the safe side.
Gotcha.
However, the issue arises when they get to the doctor, right? So if once they arrive to the doctor's office, the doctor's like, okay, there's no internal issues, but the back pain seems like it's a muscular issue. Then the advice is, all right, take Advil 3 times a day for the next 3 weeks, right? Or go to this physical therapy place that is associated with my office, because that's where I send everybody, and it's just like it's like a mill. It's like a PT mill. That's what we call these places, where there's like 20 beds in a room. It's just a mill. Everyone's given the same things. Everyone's given the hot packs, the cold packs, the electrotherapy for no reason, and it's just literally a PT mill. So that's where I have the biggest issue, right? I like that they go to the doctor just to be on the safe side, but then the road to recovery, a lot of times, is you get off the beaten path instead of following the right path to feeling how you want to feel. And instead of being there in 4 months, being there in a few weeks.
Right. And it doesn't, like, taking Advil and naproxen, I don't know, for me, like, I don't find any of that stuff helps. The only thing that really helps is that hands-on kind of therapy. And it always worries me to like take a bunch of Advil for a long amount of time. It just, that it's kind of like everything we do in society where it's reactive and you're trying to not get ahead of what's ever going on. It just kind of numbs it and puts a Band-Aid over it, but it never gets better. Yeah. I'm curious because I've been to a couple, you were talking about a 27-year-old who has like chronic pain, and that's kind of me. I was never like a professional athlete, but like I was a high level athlete, and I for sure did not take care of my body. I was a hockey player and a goalie, and I would play 3, 4, 5 hours sometimes a day without stretching, without working out, without taking care of my diet, like all this stuff. And I just feel like I've wrecked my body, my hips, my groin, my back. Like I'm always just kind of in like a dull pain. And when now that I'm older, my biggest fear is that I'm going to grow old and all this pain is going to catch up to me and I'm going to be like this crippled, shriveled up old man. And I've been to a couple different things now, and I've had kind of manual work done where they're stretching me and moving me around. I've had more, I just had cupping done, dry needling. In your experience, and I know every therapist is different, has a different belief, what kind of path do you follow? Is it a little bit of both? Are you more interested in like certain exercises and stretching to work the muscles? Are you more like of those kind of different types of therapies? What's kind of your approach to helping people? And I understand it would be different for everybody given their pain.
Yeah. Look, I honestly think that movement is king, right? Movement above everything else is really the key to making sure that, your body stays healthy. In a society where we do mostly sitting, right? Mm-hmm. Whether it's a desk job, now everyone's been working from home, right? We're lacking movement. We are movement creatures, right? We're meant to run around, move around, we're meant to run the planes, right? We're not doing that so much. So you can't have therapy, no matter whether it's virtual therapy, which I for example, I provide as well. I have people who I work with who are hundreds of miles away that I physically can't touch because they cannot come to the office. And yet we start and finish a plan of care and they feel fantastic afterwards, right? So whether it's in-person therapy or virtual therapy, movement needs to be incorporated into a plan of care, into maintaining your body as it is. Even you yourself who said, you're concerned you're going to grow older to be like some crippled. That doesn't have to be the case, right? Not at all. So I'll give you a perfect example of my own brother. So a few years back, he sneezed and blew out 3 discs.
Oh my God.
Sneezed. Of course, there was a lot of things going up to that point. Right? Obviously, it doesn't just happen just like that. Usually, there's a buildup of different kind of things that can happen. But he sneezed and he blew out 3 discs to the point of needing surgery. Almost. Like his options was either surgery or risking the conservative route. Thankfully, he risked the conservative route, and I was actually the one to rehab him, right? Pre-COVID, he was already planning to go snowboarding. He was planning to go. He just got married, so he was planning to go like hike the Alaskan glaciers, right? From being not able to walk, literally being on the couch for 3 weeks straight. He was a pretty well-built guy, lost all of his muscle, to now being able to work out and was planning to make all these big trips, and not succumbing to the fact that I'm in pain. Does that mean I have to stay this way? No, it doesn't. Right? So to loop back around to what you asked me, if you involve movement into therapy or into your daily life, there's no reason why you should be some crippled version of yourself, right? You will be the best version of yourself as long as you maintain this movement. Even myself, I have a daily routine in the morning, midday, and evening of every single day, right? I was in pain 7 years ago. I never want to experience that again. That was horrible. Very truly, physically, mentally, it was the worst. Just absolutely, I was in my lowest point. I thought that was it, right? I was a competitive ballroom dancer prior to physical therapy. I was doing that for 16 years. Going from moving and competing internationally to not being able to take a step was so soul crushing to me. And I never want to experience that again. So I move every single day.
Mm-hmm. I love that you bring that up. I heard you mention that with Paul in your chat. I was like, oh, that's dope. You know, I have an appreciation for dancing. It's more newfound, especially from like Instagram and like watching people dance and how actually physically demanding and hard that is. So that's really cool for, you know, it sounds like wrong to say, but like a guy just like openly just saying that, right? Like we're still at a point in society where, you know, that's quote unquote not cool or you know whatever you might get judged for, but I think that's awesome. I'm curious. So you said you have some routine like 3 times a day, and I assume that's on top of your normal exercise routine.
Yes.
How long do you like do this routine throughout the day, and like what types of things are you doing to move and help prevent pain from coming back?
So it varies on the day in terms of like what I do for the routine, but no more than 15 minutes, like in terms of just strictly the mobility routine. That's if I take my time. Like if I take my time, it's like 15 minutes, right? And it's just going from head to toe, right? Upon waking up, you're in a position for, even if you sleep for 4 hours a day, you're still in one position for 4 hours a day, right? And if 8 hours, then even more so, obviously. So in the morning, you're going to be at your stiffest. Just that's just what it is, right? Anytime you stay in a sustained position for an extended period of time, you're going to be at your stiffest. So in the morning, I wake up and just do head to toe mobility. Just go through different moves of getting each of my joints moving, everything, get the blood flowing, and it's as if you were never still. Right. Well, after that routine, I feel so good, so pumped up. The energy levels are high. And just to finish off the whole like mobility routine, I just do 10 quick push-ups and that's it. Right. And then I continue on with my day and I try to do the same thing in the middle of the day. And then at the end of the day, where after the whole day of movement and everything else, this is just a nice little relaxer for the body right before you go to sleep. Again, get the blood flow moving through everything and then have a great night's sleep. And this is what I recommend to all the people that I work with. Right, everyone who I work with, I give them a set routine for what they came in for. And for example, I had someone just mention yesterday, they came in for the first time, they had terrible pain, they were being ignored with their pain, the pain wasn't being addressed, and we obviously addressed it, felt better, and then she did the routine in the evening right before bed. And actually this morning I got a message, she goes, Danny, I haven't slept this well in like 6 months. Right, uninterrupted sleep. No pain during sleep, no waking up, which is amazing. Imagine
that's
not being able to sleep for 6 months.
Yeah, that's what you want to hear, right? In your line of work, that the treatment's working.
Absolutely.
And how often, like, I think to myself that like so many people don't take mobility work and stretching seriously. You know, people are like, it's good enough that I'm exercising, like, is that not enough? Like all it's so overlooked. And, I know for myself, like I'm a serious bad example of it. Like I never want to do it. It's like kind of like that, it hurts. It's not fun. It's not lifting like big weights or getting stronger, right? Like it's the little things we never want to do, and it always gets overlooked.
Well, let me put it to you this way. Do you want to get stronger?
Yep.
Do you want to be able to live through life and not have to be in pain?
Yep.
Do you want to get to 80 and feel like you're 50?
Yep.
Okay, so there we go.
Yeah.
So if these are things that you want, I mean, this is the long-term game, right? Like I'm doing my routine not because I'm in pain right now, but because that I know if I do this now, I'm going to be happier later. And I love training. I want to continue to train. I want to know that if I hit a bump in the road, my back's not going to fly out. I want to know that if I decide to play basketball at 40, that I can do so. If I lift my kids up in the future, I don't have any now, but in the future, if I decide to lift up my kids, like I don't have to be worried about my shoulders, my neck, anything happening. It's like an investment, right?
Mm.
People who make investments into stock market, people who make investments into real estate, they're more for the long-term gain. Obviously, there are short trades or whatever, but it's long-term investments, right? Think of this as a long-term investment into your body, into your health. Right? If you want to avoid the pitfalls, if you want to avoid injury, if you want to avoid just honestly feeling like shit and having that mental drain of like, I can't walk or I can't wipe the table, I can't reach for a handshake to say hi to my friends. If you want to avoid all of that misery, that mental sluggishness, that like dark hole that you feel like you can't get out of and be in pain for weeks, invest 15 minutes.
Don't put it to me like that. Don't make it sound so logical. Don't like that. No, it's funny because it's true. And I think a majority of people realize that. And I don't know. I don't know why I can never get over the mental hurdle of actually sitting down and doing it. It's frustrating for me.
Well, honestly, you're creating a new habit, right? It's like creating a new habit. And habits are incredibly hard to start. And it's just the little things, right? So even if, let's say, Ryan, even if you were to just start right now and do 90 seconds of like a neck stretch, just going around the circle with your neck, just 90 seconds a day, eventually that would cascade into more of a routine, right? It's very hard to start something new and especially do it for like saying, okay, going from no working out to saying, okay, I'm going to work out 5 days a week, an hour each time. That's going to be very hard to do. That's going to be hard to sustain as well. So, right. Yeah, you need to approach it as just a little step by step. And I'm still learning how to create new habits even right now.
Yeah.
Because again, I know that my mentality and my physical health will be thankful for it.
Yeah. So yeah, that's a good point. Everyone always tries to go so big, so fast. And that's a great point because that's me, right? Like, okay, I'm going to sit there and stretch for 15 minutes today and like 5 minutes. And I'm like, man, this sucks. I'm not. And then you just stop doing it. It happens to so many people. This is why, you get the January rush of people going to the gym. And then by February, everyone's gone. I mean, this is pre-COVID right now. I mean, it's different, but people are I'm going to work out 5 days a week for an hour a day. And after 2 weeks, they're like, this shit's hard. And then they they stop. So we'll use me as an example. Starting today, I'm going to do 1, 2, 3 things that are just going to help start this mobility, getting looser, stretching routine. What would be, just 1, 2, 3 things that would be like a great start for people to at least start them on the path to getting better at these sorts of things?
So the simpler the movement, right? If I can definitely, I'm going to show you in a moment, just quick few things to try. The key to it is finding the things that feel really good, right? So if I'm going to give you a stretch right now and it's going to feel really good, you're more likely to do it.
Right.
So the less complicated it is, the more of a chance it is that you'll do it. So for example, we're both sitting, right?
Mm-hmm.
So if you take your hands, put them behind your head,
I'm going to do
right?
it.
Let's do it. And now watch. I'm going to dip down to the side here. It's like a side crunch, right? So you're going to drive the elbow upwards and drive the other elbow downwards and try to go until you feel a nice stretch through the side.
Going off the mic. It's okay.
And go the other way. So like, I don't know about you, but this feels great. It's just opening up your sides. And this is actually a great move for people who like are experiencing some tightness or pain in the back, because this literally opens up the spinal segments, literally stretches out the muscles that we seldom use because we're always sitting or moving in a forwards and backwards movements, right? We're missing rotation in our lives. We're missing side bending in our lives. We don't do these movements on a daily basis, and we need to.
That's a good point.
Right?
Yeah.
Even just rotating the neck, for it to just dip down to the side and just look up towards the ceiling and then back down towards our armpits, bringing the chin down.
Oh, baby. I hope everyone's doing this too that's listening.
Right? So just rotating between these two positions, nice and easy, just really gently.
You can't hear it, but my neck is snapping.
Painless though, right?
It doesn't hurt, but it's a nice stretch.
Exactly. Yeah, so snapping, popping, shifting, that's all normal sensations as long as it's painless. But that's another example of just moving the neck in a way that we don't really, majority of people don't move it in, but need to, because there are muscles that do these movements, right? And if we don't get them to move around, they get really stuck and really stiff, which does you a disservice, and it just, it just tightens up the whole thing, and it does not feel good.
Yeah, and especially in like you said, the sedentary lifestyle that we all live in. I don't know how many times I see people, even myself with that neck tilt now from always looking down at our computers or being on our phone. Like, right? Like you see it like perfectly where like the shoulders are hunched and the neck's forward. And like at this rate, like this is going to be a normal point of human evolution.
Yeah, it's a little worrisome. I actually even noticed it myself because, like I mentioned, I'm doing a lot of virtual care now as well. More so before because things are now opened up more. But I even noticed myself from the side profile, I was like this. I was like, whoa, let's take a step back. Let's pull that in. In and up.
The double chin.
Literally, yeah. But that stretches out all those muscles that cramp up. But yeah, we definitely now more than ever need to make sure that we address mobility and get moving. I can't tell you how many people like have called my office saying I have pain when I ask since when, and they say right beginning of COVID, right when everybody started sitting more, right when everybody started walking 15 feet from the bedroom to the couch to the bathroom, and that's it.
Yep.
Right. What do we do? Right, and looping back to the mental health, right? We are already through COVID under a lot of mental strain, right? Not being able to go out and socialize, right? Just like we are movement creatures, we are also socializing creatures. No matter how introverted you may be, we are meant to socialize, right? A lot of people have had anxiety and stress because they weren't able to do that, and that also affects you in a lot of ways. Right, whether it's tightening and pressure in your chest or tightening in your neck because you're constantly stressed out, just the simple before anything actually happens, just that alone is so hard. It is so difficult. And then when you mix in pain on top of that, it just makes it so much worse. Right, and again, why mental health and physical health go so well together. This is why. Our mentality affects our body so much, and so many people fail to just bring it together, and it frustrates me like to no end. I'm trying to keep it clean here, but
you can go off. I told you want to go on a rant, please.
No, it's just super frustrating. It's just super frustrating to hear, people who've had such a negative experience with doctors, people who felt like they haven't been given a choice. It's just so frustrating because most of the time there is another choice. Right? Even if you can only take off 15% of someone's pain because it's just whatever they have, it's maybe a particular condition, whatever it may be. But if you can take off 15%, that can literally mean the world to somebody. But you have to be willing to address that 15%. Even when somebody comes in with the worst thing possible, is there no way you can help them? Whether through a conversation, assurance, right? Giving them something new to try, right? And these things, it's so freaking frustrating because I hear this all the time.
Mm-hmm.
Like on a weekly basis, if not a daily, just people who have been mistreated, people who have been let down, people who felt like there's literally no other option, people who were like just unsure what physical therapy could even be like because they're so used to just the generic treatment. The doctor's telling them they need to go on Advil, they need to be bracing for surgery, they need to get injections, and it's terrifying. It's actually terrifying. And there's really no need for it. Sometimes, listen, there's sometimes that people need to go through surgeries. I understand. But you cannot go by, you cannot be fear-mongering. You can't instill fear into the people who are already fearful. They're already scared. They're already worried about their health. I think all of us are worried about our health. We all want to maintain, all want to be healthy. We all want to be able to move around. We want to socialize, we want to go out without having to worry about, oh my God, what is happening right now, right? So when someone already is going to the doctor, PT, OT, who cares, whatever medical professional that someone's going to see, there already is a concern. Instead of building on top of it, we need to disperse it.
Mm-hmm.
Right? And it's so lacking. It's just unbelievable how lacking it is.
Mm-hmm. No, it's true. It's a topic that I've covered on this podcast a lot, and typically with women, especially that get mistreated by doctors, that their symptoms, that their ailments, all of it kind of gets pushed to the side, and especially people who are new to the healthcare system. And it doesn't matter if you're in America or Canada listening to this, because, Canada, we don't have to pay for it, but we have long wait times, all those different, things that we have to deal with too. Now, when they're new to the medical system, we're built to trust our doctor. It's inherently, we go to the doctor tells us what to do and we do it, and we're supposed to get better. That's the way it's supposed to work. But time and time and time again, I've heard, and again, especially from women, their concerns, and it's never addressed. It gets pushed to the side, or take Advil, or oh no, that's just something normal, it'll go away, and then it never does. And then they're spent years in the system trying to fix it, and they're it's never properly addressed. And and then it goes right into that mental health aspect where they're frustrated, they're depressed, they're anxious, the pain's still there, they go see another doctor and it's pushed to the side, right? And they never get an answer, and then that consumes them. It's frustrating for me to hear the stories. I can only imagine it's frustrating for you as somebody who talks to these patients and hears their frustration and everything going on with them. I don't know, can that be fixed? Can we get ahead of that?
Yeah. And that's actually, it's funny, like you mentioned in the beginning, having kind of a podcast tour. This is exactly why, because I want it to be out there for as many people that can hear it, whether you're a medical professional or someone that is looking to seek help. I want there to be a higher standard. I think that the medical professionals who continue to provide this low standard of care, this kind of dismissal of pain, the dismissal of mental health, the dismissal of actually listening to the person in front of you instead of just treating them as another number and number on a paycheck that comes through the door, right? Listening to the actual person, human being in front of you. The more that can get addressed and put out into the open, the more people can advocate about it, the more people can speak about it. I think once that standard is raised, once people become aware that this is the option, and all those doctors will continue to do this, lose business because of it, which I hope they do, there will be a shift. There will be a shift to quality care, right? I pride myself on this quality care, right? Will I lose business if that happens more around my area? Sure, I don't care. The point is, when someone comes in for help, I want them to get the help they need. Whether you're in New York, in Boston, in Canada, in Spain, Brazil, I don't care where you are. If you need help, I want you to get the best help possible. Right? I want there to be quality. It's just, it's the more people speak about it, I think that'll be the biggest change. And that's why I just really want to talk about these things, because the more people know, the better people will be able to make a decision. If they go to a doctor and they feel like they're not being heard, go to a different doctor. Don't hesitate. Don't wait for the second appointment. Nothing is going to change, right? If you're going to a PT and you're trying to explain what's going on, and that like you don't feel like you're being heard, go to a different PT. If he's giving you the same things that he's giving 3 other people and he's running from patient to patient within 30 minutes, go find a different PT. Your interests are not being served. Once people can see that there's another option, things will start to change, both for the patients as well as the medical professionals helping them.
That's a really good point. And I think social media has been kind of really great for that. Because I know I checked out your Instagram, and I see you have TikTok, and you know, you're doing all these like kind of like tips and tricks and stuff like that. And I know I follow a couple other physical therapists as well who offer these kind of free stretches or things like that. And it's interesting to me that you kind of choose to do that, because in a way, is that not taking away business that, you know, people can kind of get what they maybe not necessarily diagnosis, but they're like, oh, I'm having lower back pain. And if you get a couple of your tricks on lower back pain, like, would that not be hurting the money part of your business?
Not even a little bit.
No?
Not even a little bit.
Interesting.
It's fine. I used to think that would be the case. A few years ago, I started to really hone in and listen to. I've been listening to Gary Vee for years, for example, like Gary Vee, D-Rock, all those guys. And a few years ago, I started to actually apply that, and it's true. The more you give away, right, the more people can see the value in what you provide. I don't concern myself. I'll give away all my secrets, all my stretches, all my movements, right? A lot of the things I post are all original. I combine my dancing and physical therapy into one to provide the best possible movement to release any aches, pains, tightness, whatever you name it, right? But then when people see that, oh, I just did this stretch for 30 seconds and my pain is a lot better, I wonder what else he has to offer. If this is the stuff that I give away for free, what else can I do for you? I can do a lot. But that's really my mentality. Is I'm not worried that it's going to take. I can't. Like, there's so many people that I work with that have come through Instagram, which is, I love that, because I can actually showcase what I can show, like what I can do for people. I've seen messages and comments on my post saying, I've had pain for months. I did this stretch, it went away. Like, that's amazing. Even if you never come into my office, I am so happy to hear that your pain went away and that I was able to contribute to that. Right? That now maybe you can show your friends and family, and they can do it if they have pain, and that they can get better. Right? To me, I'm not concerned with the money that comes in. Right? I'm the owner of my own practice. I run my own practice. Right? The concern for any business should not be about money. If your concern is about money and you're trying to get money as much as possible, you're not going to get it. If you put the best interest of the people who need your service or need whatever you have to offer, the money will come. But only if you are there for the people. You cannot be money hungry and money grabby and expect to get it. Right? You need to show people what you have to offer. You need to be able to want to help the public, to offer them something, some value, some information. Right? The money will come, right? I don't worry about that for 1 second. So I love it. I love hearing all the feedback from people all over the world that I've been able to help.
Yeah, it's counterintuitive to what maybe our perception is of American business owners sometimes. But that's why I love talking to people and actually getting the scoop instead of what I just hear, on CNN or I see on Twitter, right? Like, you can actually get a firsthand experience about what people are thinking, what people are doing, and the actual methods behind the madness, quote unquote. Okay. I have lower back pain. Now's the consultation part of the podcast. Okay. Are there things because I think maybe one of the most common things is when you get a knot in your back or your neck. Is there things that we can do on our own to either prevent knots or get them out? And I'll preface it by saying, okay, so I have this little ball that I like to roll around on. I have a couple foam rollers. I bought a Theradrill at the beginning of this to friggin', get to the bottom of it. And all these things, all they did was bruise my back and did not get the knot out. So now I'm on all the other options of of physical therapy and getting needles and dry or cupping, and now I'm going to massage. Okay, so are there things that people can do to at least get those knots out, whether it's stretching, whether it's movements, whatever?
Absolutely. And before we get to what we can do, it's also important to know that the low back, like when you have low back pain, actually, for example, let's take a step even further back. Where do you feel your pain? Would you say that it's right on the hips, or is it like on that borderline between like the hips, like the glutes, and the actual back?
Yeah, it's kind of like it's like almost dead center, right between like on the hip from the glutes in the back, right in the middle between the spine and like the other part of the hip.
Gotcha. So great. So that's awesome. And now, obviously, I'm not going to diagnose you because that's
yeah.
But what people need to know is that low back pain is not just back pain. Low back pain, think of it as like a highway. Like a highway in California. You got 4 lanes on each side. All of it's like blocked up. All of it's connected, right? There are so many things that go into low back pain. For example, your back itself may be totally fine, but there are muscles in your hips, like your glute medius, for example, or your glute maximus, or your piriformis, or whatever. That is just, it's tight. There's something in there, right? Based because of how you sit, how you move around, whatever it may be, right? And the second you just release some of these muscles in the hips and you get them functioning properly, your back pain goes away. Right? People are so focused on, okay, low back pain. Oof, something's going on in my low back. Is it a disc? Is it a this? Just take a second for a moment.
Yeah.
Right. Be aware of the fact that if you want to address low back pain on your own, which again I always suggest going to the PT, right? Like to be in a proper guided route, right?
Mm-hmm.
Rather than trying to self-diagnose and self-find things.
And bruise your back.
Sorry?
I said, and bruise your back.
And bruise your back. But yeah, so if we address, like, if you try to go through all the different things, like mobilizing the actual low back itself, kind of like this move that we did with the hands behind the back, right? That is primarily for the back itself with very little involvement in the hips. But if you take that little ball, for example, were you laying down on the floor or against the wall?
Against the wall.
Okay. So if you go against the wall, instead of rolling on it, what if you just found a tender spot, apply a gentle pressure on it, and just lift your leg up and down? Like bend the knee and just lift up the knee up and down. And then out to the side. Right? Instead of rolling on and bruising the tissue and causing pain and inflammation, it's so much better, and this is why I hate foam rollers, but that's another story. It's so much better, for example, to apply light pressure to a tender spot and go through range of motion. By applying that anchor spot, you're actually manually releasing pressure that a PT would do, for example, right? Providing manual pressure that releases tension, and you go through range of movement, and it helps to unload pressure and release tightness. So much better than bruising your back and making it so excruciatingly painful for no reason.
It's it's something I knew, but it's not said enough that it resonates with me that, like you said, that so many of us have lower back pain, or a lot of people with the neck pain, like we were talking about, and our immediate intention is to maybe rub, like you take the Advil, whatever, but rub 8535 on the spot that hurts. And it goes into that spot where we're not actually addressing the issue of why that spot is hurting. We're just trying to take away the pain. And that's why I think maybe why and you can correct me if I'm wrong, why it seldom works. Like I've been friggin' slapping on Voltaren like there's no tomorrow. I've already went through since Monday an entire thing, and it's done shit. It's done nothing. I hate it. But that's probably the reason why I haven't got the right spot. Although I think Voltaren's a sham. I don't think that stuff's real. It doesn't work.
That's so funny that you say that. I worked with PT when I was doing my clinical rotations for school, who like swore by Voltaren and like used it religiously for everybody. But so like even Voltaren though, Voltaren is an anti-inflammatory as well, right? It's like the safest and anti-inflammatory, whatever. But if your issue is not an inflammation issue, right? It just your tissue isn't moving properly. Voltaren is gonna do nothing. It's gonna be shit. You're gonna use the entire tube, and it's like, well, what have you done for me lately, right? But that's why, like, I'm gonna loop back to what I said earlier. Movement is king. If you provide the proper movements to the area, the proper mobilization, and just healthy moving from the muscle tissue and from the joints and everything like that together, your outcome is going to be so different. I was doing a virtual therapy session with this woman a few weeks ago, and I'm using her as an example. There are many, but her in particular because she's tried everything, all the creams, all the natural, the Bengai heating thing, the Theragun, the massager, the Advil, the heat, the cold, nothing. We did 2 moves. 2. She wasn't able to lift her shoulder. We did 2 moves, it went up to here. Before it was able to get here max, not even to 90 degrees. We did 2 moves, boom. Where are your pills? Where are your cream? Right? So movement really is such a beautiful thing if done properly. So even for yourself, for your lower back pain, and I'm sure we're gonna discuss it after this podcast episode. Like we need to try some things to get your hips moving, to get your back moving. Everything has to be returning back to its stabilized function. Right, when people have low back pain or shoulder pain from, let's say, you hit your shoulder on the floor, you hit your shoulder on the floor, right? Or even give you the example of D-Rock, he broke his clavicle, right? I'm working with him, and aside from waiting for the clavicle to heal, what can you do around the area, right? Most people would say nothing, just do light ranges of motion, that's it, whatever. But no, we went right into releasing any tension that he had around the neck, in the chest, in the shoulder, and the healing is so much better. By week 3, his arm was up here, even with the broken clavicle, and no pain. Right? So it's just about addressing the right things properly.
Right.
And then you don't have to rely on all these creams. They can help, like not make it worse.
Right.
But they shouldn't be the things that you rely on to get rid of this thing.
What I love about what you're saying is when we think of physical therapy, massage, whatever, right? I don't know how it works in America, but in Canada, we typically get like a set amount from our employer on benefits. So we get a little bit covered by our employer, but then the rest is up to us. But anyway, it is more of an expensive service. But when you think about, okay, so you're talking about that girl who tried everything, probably spent $1,000 or more on trying to fix herself with no results. And then in 2 sessions, which is $200 maybe, it probably not even that she was able to find relief and fix it. But yet we have no problem spending the $1,000 on pills, on creams, on muscle massage guns, on foam rollers, on all these different things, thinking that it will save us money or help. But we won't go, and a lot of us won't pay, and especially after our benefits have run out, won't pay for a service that won't actually help. And even further to that, we'll go and drop $100 on dinner. I mean, maybe a little before COVID, order, $100 worth of booze for the weekend. Whoa, but $100 for a PT? Ooh, that's expensive. I can't afford that. when you're in the moment, you don't think about it, but saying it out loud, it's like, damn, we're stupid.
Yeah, it's actually really funny that you mentioned that. And I'll tell you what, I am actually out of network with almost all insurances. So like if someone wants to come see me, unless their insurance policy reimburses them for the cost of the appointment, I'm what you call out of pocket, right? Or like a cash only clinic, because I refuse to bend the knee to the insurance companies and treat people how they want me to treat them, not how I want to treat them, right?
The power.
Yes. So I'm not going to pretend like I'm cheap because I know I'm not, right? And that's why I also have a 100% money back guarantee, which I don't think any doctor has, or none that I know of personally. And that if you're not happy with the experience, if you're not happy with the service, you get 100% of your money back. 100% of it, no questions. You shouldn't pay for something that doesn't work, especially at premium price, right? So that I firmly believe in. But and this is actually something I have to always address with people for the first time. It's, wow, $250 for a session, that's expensive, right? That's really pricey. I don't know if I can do that, right? And it's like, you go to dinner, $100 there. You go buy yourself new shoes or a new pair of pants that are not for functional reasons, like a $20 pair of jeans, but they're like $140. And you splurge on that, yet you won't splurge on the investment in your health. Those jeans will wear away. That bag you're going to stop using after 9 months, right? Those shoes will yet your health is you're going to keep for the rest of your life, right? People will say, oh, that's expensive, I'm going to just wait, I'll shop around a little bit, and 3 weeks goes by, they still haven't received help, and now that pain has gotten worse. So people, the way I try to make people see it is, you need to really invest in your health. It's a serious investment for a serious solution for a serious problem that if you continue to sit on or you don't get the proper treatment, it's only going to get worse. I've had people who I've spoken to about it and they're like, no, I'm sorry, it's just too expensive. They went to another physical therapy office and then 5 weeks later, they were coming right back.
Yeah.
It happens. Right? It's heartbreaking because they just spent 5 weeks getting little to no improvement for something that could have been taken care of in 3 or 4 or however long it takes, but it'll be taken care of, right?
And they spent more money, going a bunch of times.
Of course.
Once, 2, 3 times.
Money, time, mental effort, the constant not being sure if your next appointment is going to help you or if it's continuing to be the same. That's also frustrating. That's also really psychologically draining, knowing that you've been in this, like looking back at 5 weeks and seeing not much has changed. Why, is this ever going to go away? And that's another downward spiral that I hate to see people go down. It's really heartbreaking. And
not to say that these people are wrong or bad, not to judge a book by its cover, but I don't know if I'm trusting the $50 physical therapist out of his basement. It could be good, but at least first step, you're like, you kind of get what you pay for. If someone's offering that, a premium service for a good amount of money, I'm going to assume they're really good. So it's good that you offer that money back guarantee to also, put that kind of that worry, that anxiety for people, because money's tight right now, especially now that they have that have that out too. That's huge.
Yeah, I'm a firm believer because I wouldn't want to go for a service and pay for it and then it not working. I'd feel like holy shit, I just put all this money into this thing which was supposed to help me, but it didn't. I feel, even though the person tried their best, I internally may feel a little robbed. And I would not want people to feel that way. And I haven't had anyone request it yet because everything has been so amazing. But that option is always there, and it's just as a reassurance. And the $50 PT in the basement, If you need heart surgery, are you going to be looking for the cheapest heart surgeon? Probably not. Probably not. It's gonna be really expensive, but you're gonna try to find the best that you can like live on. And not to say that PT can compare to heart surgery, but it's the same thing, like you mentioned. It's if I am free to do what I think is best, right? Not what I need to tick off on the insurance and why I need to see 4 or 5 people an hour. I see one person an hour. I see 10 people a day tops. Meanwhile, people who accept insurance see 4 to 5 times that amount in a day. I'm happy. The people that come in are happy. We address what needs to be addressed physically. We address what needs to be addressed mentally. The insurance is there. The happiness is there. We crack jokes in here. I have time to connect to people that come into me and see me. Instead of being like, okay, 15 minutes, all right, stay right here. I'm going to run out. I'm going to put you on this machine that's going to really do nothing. They don't say that, but that's what it does. Nothing. And run to another patient to take them off the machine that did nothing, to go put the other patient back onto the machine that did nothing. And on this cycle goes, and they're in therapy for months.
Yeah. It becomes like a money farm, basically. Like we were
again,
talking
like
about earlier.
Yeah, PT mill. That's all it is.
It's kind of how we're all processed in everything, right? Whether it's food, whether it's like this, doctors. Like I said, I reference it a lot. We're in different countries, different systems, but there are a lot of similarities in the way people are treated as a commodity, as that number, as that, okay, in and out, 15 minutes, not making money, see ya, push you out the door, next. To get a human connection with it as well, that does so much, because then you build trust too, right? Like if I know you, I'm going to trust you that you're doing the right thing, instead of the person I barely know just poking at my back and then like I'm gone in 20 minutes. Like it's just, I think it just does wonders for everybody if we could move all of our systems into this into your way of thinking and out of the commodity model.
And what you mentioned, trust is huge. Earning someone's trust, even outside of like a doctor-patient setting, getting someone to trust you is so hard. It's so hard. The older we get, the more experience we get with people backstabbing us, people who we thought we could trust but don't trust. Trust is very hard to earn, but so quick to lose. Right? So when someone comes in to see me, I try to earn that trust so hard. I try to make sure that we establish the connection so hard, because if you're not trusting what I'm doing, if you're not here for the ride and kind of looking at it from the outside, like, oh, I don't know about all this, that it's not going to work. It's just not going to work out. Mm-hmm. When you go to see a physical therapist, or when you go to seek help, like you yourself, Ryan, like I'm sure when you go in, you want to be treated like a human being. You want to have a connection to the person. This is intimate, right? Physical therapy is intimate, right? This is a human connection. Unlike surgery, for example, right? Surgery, I mean, you talk with the surgeon before and after, but surgery, you're out. You're knocked out. You're being opened up. You're being fixed up. Whatever. You wake up. Surgeon tells you what's up, and out the door you go to the physical therapist. But physical therapy is intimate. It's an intimate experience, and it needs to be treated that way, because we're getting you back to you going on that run again. Right. And the plans that you told me in the beginning before we started recording, like, I'm sure you want to get back to that. Right.
Yeah, it sucks.
Yeah, absolutely. It sucks. And it happened on the second day, you said, right?
Yeah. And just tried to tough through the pain. I was like, I'm going to be David Goggins. I'm stronger, man. And yeah, no. Then I couldn't walk. I was like, great.
Yeah. So that kind of like that all needs to, I'm sure you want the person that you're seeking help from to really connect with you about that, right? Mm-hmm. For him to tell you, Ryan, I'm going to make sure that you get back to running and lifting and doing whatever it is that you want to do as quick as possible and as safe as possible. Ryan, I got you. I'm going to take care of you, right? And if you have any questions, I want you to ask me them without hesitation. Anything and everything. Even if you think it's a stupid question, there's no such thing as a stupid question. Right? And that's how I talk to the people that come in. I make a joke where, if someone's a little quiet, someone seems like their wall is up, I say, listen, if you don't ask me at least 5 questions by the end of the session, I'm going to be extremely upset.
Mm.
Kind of a bad joke. Like, it's not very funny, but it gets a little chuckle because they're not used to that, right? They're not used to, I'm going to turn the screen here, seeing these charts up and actually having someone to explain all of that.
Yeah, that's true.
Right.
Yeah.
A lot of doctors have all these fancy schmancy charts of the anatomy of the human body, mostly for decoration.
Yeah.
I named all of these.
I thought it was just to read while I'm waiting for the doctor to come in the room.
Right? You'd think.
Yeah.
No. Here's an anatomy lesson. Because really, like, you need to know what's going on as well. So I literally show you, here's the muscle, here's the this, here's the that, here's what I'm doing, here's why I'm doing it. Right? And that all cycles back into trust. I want you to know exactly what I'm doing. Because if you know what I'm doing, you understand it, you identify with it, and then you trust me because I can explain to you what it is I'm doing. You know how many times I've heard people tell me that when they ask their doctor a question, and this is why people get really hesitant, when they've asked their doctor or another PT a question and they were just like, just trust me? What the are you talking about, just trust me? No, that person just asked you a question. You answer that shit. Like, you answer every single question. What are you doing? Just trust me.
Yeah,
That's
it's
not a
sketchy.
thing. Yeah, well, it's just a superiority complex that's unnecessary. Obviously, you know more than the person that's coming in to see you. That's why they're coming in to see you. When I go to a mechanic for my car, I don't expect to know the answers. I expect them to tell me what's going on with the car. It's the same thing here. People need to feel comfortable, to be able to trust the person they're talking to, that they understand what the pain is, that they can explain it to the person why they're going through that. That is so important. So important.
Yeah, man, you're doing some great things. I wish I was in Brooklyn.
Come on by.
Down. Before I let you go to making people's lives so wonderfully better, did I miss anything that, like, you want people to know? That, whether it's final words or anything. We'll get to the plugs in a minute, but, like, is there something I missed that, you want people to know, to understand, to get off your chest? The mic is yours.
Well, the last thing I want for someone is to feel stuck, right? To feel like they're out of options. Where, again, regardless of where you're from, whether you're in Brooklyn or in Canada or wherever, don't feel like you have to be stuck with your doctor, with your PT, with whoever, right? You, as the person who is seeking care, have the opportunity to shop around, essentially. If someone is not satisfying your needs, you go elsewhere, right? So really, for the people who are seeking help, don't feel like you're a prisoner to the healthcare system. Find the solution that's best for you. Find the provider that's really best for you. Don't be scared to find someone else. You've been with a doctor for 10 years, but just because you've been with him for 10 years, you've been unhappy for 10 years, you're just doing whatever he says, find a different doctor. Find a different PT, right? Be the one to take that proactive step to better your situation, right? So please do not feel stuck. Take the extra, put in the extra elbow grease to find something that works best for you. And for the healthcare providers, step your shit up. Step your shit up. Connect with people. Treat them like people, not like dollar bills that are walking into your office or through your door, right? Be there for them. I'm no psychiatrist, psychologist. I'm not that. But it doesn't take those professions to care about the people that come in. So just showing genuine care, just being able to provide as much information to the person as possible, within the respective profession. Be there for them. Don't just let it be. Like, be responsible. So that's really the two things that I just want to make sure that people know. Whether you're a patient, medical provider, or anything, like any business whatsoever, be there for the people. Be there for the people that need the service that you provide. Don't think about the money. Be there for the people.
Yeah. And one thing I've talked about here with a few different people, be your own advocate. I think it's just, fight for what you need, what you want. And just like you said, don't settle if, exhaust all possible options. This has been really great. Taking a lot from it. I think we all are, we're all going to start stretching now for sure.
Better.
If people want to follow you on social media, I know you have a great Instagram, TikTok. Where can people find you and get more info?
So if you're on Instagram, you can find me at the at handle is official Danny Shapiro. So that's on Instagram. That's my main platform at the moment, although I'm trying to build up Twitter a little bit and share all the things on that community as well. But Instagram is official Danny Shapiro. On my Twitter handle, it's actually at project_PT. And there I'm also sharing a lot of on Twitter's where I share more of my mentality of how I approach things, positive notes, just things like that. And of course, if you're interested to see what I am about and dive in deeper into what my practice is, you can always visit me at projectphysicaltherapy.com.
Beauty, man. I really appreciate you joining me and sharing this. Like I said, I think it'll get people thinking at the very least, and then hopefully maybe come see you, go see a PT, and I'm like you. I just want people feeling better. I want people feeling good, physically, mentally, and like we talked about, they're both connected. So it's just, as a mental health advocate, it's huge, and I think it's really important. So I appreciate it, and I appreciate you. Thank you.
Thank you so much for having me, Ryan. I love this. This was amazing. Thank you so much.
You take the red pill, you stay in Wonderland, and I show you how deep the rabbit hole goes.